we are going to continue to focus on what our mission is, which is food safety. Now, a lot of us in the room have probably either had a foodborne illness at one point in time or heard of, major outbreaks that have happened in our country. You know, the child who grew up in the 90s, right? We hear about E. coli outbreaks from hamburger restaurants and all of these outbreaks that we know that happen from time to time, and that's with food safety oversight. So when we see an issue like this, where we have businesses coming into town and operating without food safety oversight, without basic sanitation practices in many areas, it's really concerning to us from a food safety perspective. And you can see kind of up on this slide, I have a couple of points here about just how far we've come in modern food safety since the early 1900s, from the time when we had to be concerned about chemicals in our meats or chemicals in our milk or all kinds of different outbreaks that were really impactful and really impacted people's quality and duration of their lives. So we've come a long way since the early 1900s to the point now where we have in Washington state our local health jurisdictions like us here at Benton-Franklin that directly oversee food safety. You know, we inspect the restaurants that you eat at, we inspect the grocery stores, the schools, anywhere you could get food. And this is really why, again, this is why we're here. This is why this matters to us so much, is we still see quite a bit of foodborne illness in our country. And this is, again, this is with a pretty, pretty robust food safety system. We still see about 50 million foodborne illnesses each year in our country, about 128,000 hospitalizations and about 3,000 deaths each year in our country. So it can be very impactful. If numbers don't speak to you, then maybe stories do. So here's just a couple of stories that I pulled out from some of the more prominent outbreaks over the last couple of decades in our country, right? And when we see the people at the top of that pyramid that I just showed you, the people that are hospitalized or die from foodborne illnesses, typically they are going to be our children, our elderly, pregnant people, immune compromised, those that we really have the most care and concern for in our community. And you can see here a couple of stories of, deaths, hospitalizations, complications, lifelong health complications, and just some really significant impacts from foodborne illness. So that is really the reason that public health is showing up and will continue to show up around this issue. It's very important to us. Okay, switching gears just a little bit. Before we talk about a little bit of background with these unlicensed food vendors that we're seeing, we wanted to also share a little bit about what we do at the health district, because I know there's probably going to be some questions coming up around our process. What do we do to work with food vendors to get them permitted, to get them licensed? What's our role and our responsibility in food safety in our community? So I'm going to talk about that. And then Ariana is going to talk a little bit about our permit types. What kinds of permits could you get if you're a business looking to get permitted, and what kind of help can the health district give to you? And then we'll dive in a little bit to the main topic. So food safety responsibilities, this should be no surprise to everybody, but the slides I just showed you with foodborne illness, deaths and hospitalizations from foodborne illness, that is really why we think it's really important that we have this important role in sharing these responsibilities around food safety in our community. So as the health district, our role we see is issuing permits. We conduct inspections, we conduct investigations and illness complaints when somebody does report a public health concern to us. And we hope that also the other areas of our community, our businesses, they get permits. They practice safe food handling. Our consumers practice safe food handling and report issues when they see it. So we feel that we all have a shared responsibility, which is part of the reason we're here tonight, right? To come together and have that conversation around this issue that we're seeing increasing. So I'm going to hand it to Ariana, and I'm going to have her talk a little bit about what we see as our 5 main permit types for our different types of food establishments here. So if one of these vendors was interested in getting a permit, how do we work with them? How do we work with restaurants, prospective business owners, for food trucks, for temporary events? And then she'll talk a little bit about our permitting process as well.
Some of our type of permits, if you look at restaurants, so restaurants is more like a brick and mortar, you can go in, you can sit down, you have an approved kitchen. You're usually allowed to have a wider menu because you have the approved kitchen, you can do riskier processes. Another type of permit would be our mobile food permit. This is our food trucks, as well as like our carts, like the hot dog carts, the fruit carts. These usually prepare their food at a commissary, which is an approved kitchen. All the food gets prepped there, or the majority of food gets prepped there, then transported onto the truck or cart where it is sold, and then it is brought back to the commissary where it has access to electricity and all that to keep the food safe in the proper temperature during the time. Other types of permits would be like I said, a food cart, and then a temporary event would be like when we are celebrating something such as Father's Day, 4th of July, we will see vendors with a booth, a tent up top, and they would be selling like hot dogs, pots. There's a lot of vendors. Another place you would see them would be like farmers markets, fairs, and then the other type of permit would be catering. So catering is used more for like banquets, big private events in which, again, all the food is prepared in an approved kitchen, transported safely in appropriate equipment, and then served with the same safety guidelines. So to get a permit, there's a couple ways to go about it. You can either go on our website and you can go to food safety program. You can go to the applications tabs and download which application fits what you're trying to do best, fill it out and send it through our email, or you can come in person. In person, we do have these nice food safety packets, which have all the paperwork you need. You can sit down with an inspector, kind of discuss your dream, what you want to do, and we can give you the guidance. Once you turn in your application, you will pay a plan review fee, you will be assigned an inspector. The inspector goes through your plans individually, guides you through what you don't know, what you do know, helps you with your processes. Sometimes processes are just missing key elements that we just need to review. Sometimes things need to be tweaked, and the whole purpose of the review is to catch things in advance, so we avoid foodborne illness. And the sooner you start the process, honestly, the best, because we have more time to catch errors, we have more time to go over things. And really our goal is to get you open when you want to open, so the earlier you apply, the better. Once you go through the planning process, you will get approved. Once you get approved, you pay your permit. We go out there, we do a pre-op inspection, we verify everything we reviewed, we make sure everything is good to go. Then you are allowed to open. Once you're allowed to open, you are in service. We do an inspection promptly after to just make sure that we're continuing those good practices that we discussed during the plan review, and then you're inspected routinely throughout the year. Again, to ensure those good practices are still being practiced, that everything is staying to the standard of sanitation and food safety.
All right, thank you. Yeah, I think, you know, one of the points there we wanted to really highlight was how much, not just oversight, but how much assistance we try to give people throughout the permitting process. Education is always where we start. We'll talk about that. I'm sure the question will come up about education versus enforcement with these vendors. And each health district is a little bit different in how they approach things, but I know here, and in fact, most across the state, education is where we start. Our goal is to educate. Our goal is to bring vendors into compliance, not to push them out. And so, you know, what Ariana was highlighting there is throughout that process of getting your permit, you're going to be assigned an inspector. You're going to have somebody to sit down with you and help you, guide you through the process to get permitted. So we do put a lot of effort into trying to bring people into compliance, not just for the permit, right? Not just for the red tape, but for all of the food safety guidance that you get through the process to ensure that the food you're serving is safe and met minimum standard. Okay, we're gonna again shift gears a little bit again. We're gonna talk about what the kind of main topic today is, which is these unlicensed vendors that we're seeing in Benton and Franklin counties. It's probably not lost on you that we have somebody from the State Department of Health here, which is because we're not just seeing these vendors in our counties here, we're seeing them across the state. And there's a pretty consistent pattern with what we are seeing and what other counties are seeing, which is here in Benton-Franklin Health District, we have seen over the last about 2 years, about 18 months, a really sharp increase in unlicensed food vendors that deliberately avoid permitting. So not food vendors who are interested in coming and meeting with us. We've done the outreach, we've done the education. They're deliberately avoiding permitting and not interested in getting permits. We have had an increase in our complaints of unlicensed food vendors by 119% in the last 2 years. So that's over double the amount of time that we're putting in and the amount of resources that are being taken away from inspecting our routine restaurants, our caterers, our schools, our grocery stores, all of the places that we do see that are getting permitted and trying to kind of meet that basic bar. So we are really here because, it's our perspective that these vendors not only are a bit of a threat to public safety, but also we're hearing increasingly from local businesses that are very concerned about these vendors coming in. They're not local mom and pop. They're coming in from out of area, from out of state, operating without permits, operating without basic sanitation, and impacting the bottom line of our local businesses is what we're hearing. Clicker's not working. Okay, thank you. So a lot of what I just said is represented here on this slide. Here's the kind of the themes that we're seeing with these vendors. This particular type of vendor we see will set up close to busy streets. They're advertising on social media. They're very organized business structure. A lot of this conversation goes well beyond public health and really necessitates us working with law enforcement to really find out what's going on. But there are signs that this is a larger, more organized, coordinated operation, not just again across our area, but across the state and maybe even multi-state. We're seeing some pretty unsanitary conditions in food safety. There's a lot of basic food safety practices that are not being attended to, no hand washing. You'll see some slides a little bit more later. And again, there's a lot of vocal concern that we're hearing from local businesses and other licensed food vendors because these vendors are not only taking business from them, but kind of undercutting their ability to do business because they're not operating with permits and not operating with a lot of things that they should be. So their ability to sell food a little cheaper is becoming known. Okay. So here's a little bit about some of the food safety concerns that we're seeing, and this is a pretty consistent pattern at a lot of these locations where we have very, we don't have clarity around where the food is prepared, whether it's prepared here locally, out of county, we don't know. We've heard from some others, counterparts across the state that there may be some food hubs where the food is being prepared and kind of carted out to locations. Foods consistently we're seeing without any temperature control. So coming in the backs of vans with no refrigeration, sometimes hot food being held hot, but sometimes not. Often they're selling these meat on kind of the spit that you see up there. And I had the opportunity a couple of weeks ago to go out with the inspectors in the field and took some temperatures while Ariana here was working the rest of it, and the meat was at 89 degrees on the spit. So we're seeing undercooked meats, raw meats on top of other meats, foods that are cooked and cooled and reheated several times, no hand washing, no produce washing. nothing that we would consider kind of the basics of what this is really looks like, a temporary food booth, what you would see at maybe a festival or a fair, and yet none of kind of the basic structure that we would expect to see there. Thank you. Oh, yeah. So here's just a few more pictures of what we're seeing. These are all from our local pop-ups here. So we've got lots and lots of preparation of produce with no washing, no glove use, no hand washing, lots of foods being held without temperature control. So you can see the picture up there with the red bag, that's raw meat sitting right on top of some cheese. And we're just seeing a lot of that pretty consistently at each staff that we go to. So I shared a little bit about this already, but a little bit more, and I'm sure, you know, Susan can probably speak a little bit more to this and what we're seeing across the state. But this is not just in Benton and Franklin counties. There are many local health jurisdictions across Washington that are facing similar challenges. And again, some of this goes beyond public health, but there are definitely signs that this is some sort of a connected network of vendors, because the setup, the vehicles, everything is almost identical that we're seeing across the state. And there's a lot of barriers to enforcement. And the level and the authority we have as public health to conduct certain types of enforcement, we are not law enforcement officers. So this is requiring us to work very closely with our law enforcement partners to find a way to tackle this issue. And just a couple of quick stats in terms of what we're seeing here. I already shared with you our sharp increase in the number of complaints that we're seeing in Benton and Franklin counties. But what does that mean for us, right? We have 120% more complaints since 2023. Each time our food safety team goes out, we typically will do kind of focused enforcement days. So we're gonna, gather 6 or 7 complaints on these during the week. We don't have the resources to go out every night. And so we'll, have a focus night every week or so. And one vendor can take us up to 2.5 hours to work with. And so that's significant when we're getting 6, 7, sometimes 8 complaints of these on a single day. That is more time than we have staff. And so it's cutting into our bottom line also. That's not our biggest concern. Again, our biggest concern really is the food safety issue here, and just the undercutting of fair business competition, public trust in, government and public safety institutions like public health and law enforcement, and where that goes. Here's just this is a little bit blurry, I apologize, but here's a map with some of our locations across Benton and Franklin counties. We have pretty consistently about 11 locations that are really consistent that will rotate. But you can see from this map, there's a scattering of many, many more than that. And they'll pop up one place. Maybe we'll work with the business owner there to have them removed from the property or remove their approval to operate at that property. And the next night they'll be right next door. So it's become a little bit of a difficult situation to keep up with from a public health standpoint, but we will continue to do it. And again, we're happy to have Department of Health. We've had connections with some of the business coalitions working on this, some of the community funds, local business owners, and law enforcement to start coordinating some solutions around this. With that is all I have. Amanda, I'm going to hand it back to you.
This one is for me. I also too, looking at such a wide variety of people that are really involved in this. I also want to point out that we have Rudy Almeida from the office of Governor Bob Ferguson here as well. He's the regional representative of Central Washington. So this is something, again, that's not just locally, but also, Susan, I don't know if there's anything super specific as well from the state department that you would like to share for the Department of Health.
Here's something, yes.
Thank you very much. I just want to mention, Erin talked about it, but this is definitely a statewide issue. We have seen this where we have vendors making food in King County and transporting that across to Spokane. She mentioned that we see foods at improper temperatures. I think for most people, that's like, oh, well, just heat it up really hot. We have a lot of germs that cause outbreaks that cannot be solved by reheating. So we really want to make sure this food is safe at all times. A lot of the products that are coming through are very high-risk foods for us that have linked to quite a few outbreaks. Additionally, we are finding foods coming from out of country. And so we're not even sure that it's an approved meat supply that we've seen. And just for some awareness, she talked about the bottom line here locally. Some of these vendors are reportedly making several $1 million by doing this food service. And again, totally working around and purposely trying to avoid local health departments and local law enforcement. Over on the west side, we've had individuals that the city was responding, and so they went right outside of the city line and actually started to operate within the county because the county wasn't able to participate. I think that's one of the important things I want to bring across is the jurisdiction is very difficult. A lot of people think that the health department has authority to close. We really do work on education. We do believe in due process. Our rule requires 10 days. I mean, it's like we try to get people into compliance over time. And so we don't have authority to just automatically stop. We don't have authority to discard food. We don't have authority to denature it or make it so that people can't eat it later. And yet it can be very unsafe. We really rely on partnerships. And part of that partnership is our communities. One of the biggest things that we're trying to bring awareness to, and we've done quite a bit of education on this, is talking with customers to say, please look to see if this is a permitted food establishment. All right, talk with your local health departments, talk with your local cities, get that partnership, because part of it is to cut down the demand and the supply will move on.
We're working on getting the other mics. So thank you so much for that. And also I know we have Dr. Krager, our health officer as well online. I don't know if there's anything super specific, Dr. Krager, that you'd like to add before we start fielding questions from our audience in person. And then it also looks like we have any questions online as well.
Thanks, Amanda. Just real briefly, as a physician, I've seen, some of the illnesses that we've been talking about related to food. And it can be really devastating for people, obviously, like a hospitalization, but even just a loss of work, loss of school, a whole family, out sick because it got passed around. Some of these things can be really devastating and again, make you very ill, can cause death in worst case scenarios, and also, sometimes just long-term complications. So I'm here if anyone has questions about those specifics. Thanks.
Thank you so much, Dr. Krager. And that starts our Q&A here. Is there anyone who would like to ask any particular questions of our panelists? Anyone at all before I start taking online? And again, don't be shy. If you want me to start online, I can as well. Sir, if you don't mind coming down to the front here, we have a microphone just so that our people online can hear.
Probably don't need it. Dave Martinez with the Latin Business Association and also with La Voz Hispanic newspaper. Suzanne, right? You just mentioned that you guys don't have the authority to discard food, but I witnessed Adriana and Derek went out to one of the vendors, which all rights, they shut them down and told them they had to leave. Police department was already there when I got there. And Adriana and Derek forced them to throw away all the food. The police department was there also, and I know him personally, and he told them, don't throw it away, put it back in your containers and put it away. So I saw a conflict there. I saw disagreements between the police department and then the the inspectors that were there. So which is it? Do you have authority to discard, to throw away food, have them throw away, or you don't have the authority to have them throw it away?
So our code does not have the authority to have us do this, or it would be done by the person that's running the booth. And now the local board of health or their policies could provide that authority, but it's not in our state food code. Okay, but it is the direction of the person in charge.
And that's exactly what I found when I investigated to see who had the authority. The inspectors have the authority to have the vendor throw all the food away, or they didn't. And then I went back and talked to the police department. They said, well, we didn't see any authority of anybody throwing anything away. So that's why we told them, go ahead, put it away, put it in their van and leave. And we did the right thing as the president of the Latin Business Association said, you know, follow the process. Go visit the health department, get your permits, get your UBI number, get your state UBI number, get your federal EIN number. Follow the process, and you'll be right back here selling, you know, when you do the right process. So that is what we do as a local Latin Business Association, is talk to the vendors and tell them to do the right thing. But you're right, you're popping up all over the state.
And I appreciate your angle that you're taking there. And I want you to think about it as a customer, because as you mentioned, they could take that food and then try to reserve it, which is what we have seen. And so there is a conflict there. You know, public health wants to prevent people from consuming it later, whether it's a human or an animal. They want to make sure nobody is going to be attracted to this food. And it makes it very difficult because it is the authority of the person that owns it. And that would be the person that brought it. That's one of the reasons why, you know, the partnerships that we're talking about right now is getting that message out there. So I appreciate the efforts that you're going to as well. Thank you, Dr. Mr. Cortinas.
I gotta be very patient as I ban a white today. Yes, do you mind coming down to the front? Now, these microphones just take a hot second to turn on, so I'll go ahead and stop talking in just a moment, and then we'll get the audience mic on as well. Again, for anyone online, I'm still looking at your questions. We will ask them very soon. Yes, please.
Can you hear me? My name is Kennedy. I am co-chair of the Community Fund. We have one of our services that we do provide is we do business education, and we have tried. So we have staff all over the state, and we have tried to work with many of these unlicensed vendors. We guide them to the system process, but we realize that they are not interested in getting licensed. They don't want to participate in our local economy. They don't want to pay taxes. So I see that it's very difficult for you guys to work and to do any enforcement. So I appreciate your work, and I understand that this is something bigger than what we have here. Thank you.
Is there anyone else in the audience who has a question? Oh, Erin would like to respond.
Oh, there it is. Okay, I just wanted to respond also, just to thank Anna, thank you for that comment. And I know that you've already engaged with the health district a little bit, and just tagging a little bit on what Susan said earlier. I think those continued partnerships are what we're going to need to do to continue to kind of bring this issue a little bit more to light with our community, because
We agree, where I said earlier, we're interested in bringing people into compliance, not putting them out. We want to see people get licensed to become part of that business sold. But we're also seeing there's not much interest, but we're here and ready, if that's what they want to go.
No, I appreciate that. I think that's where my question will stem from. So if you have unlicensed vendors who don't want to get permitted, they don't want to go through the process, and you've demonstrated by people dying, we don't know where the meat or the food's coming from. How does that process of enforcement happen? So, I mean, it gets to a point where, like you said, I mean, like Ms. Cortina said, that place got kind of shut down one day, and then the next day they were there again. So what is that process? What does that look like? What does shutdown look like? I mean, what is the city? I guess I should have started off with, my name is Leo Perales, I'm the Pasco City Council. And so that's Our problem is that honestly, if they're not gonna go through the process and get permitted, they should just be shut down. So what exactly needs to happen? How do you partner with law enforcement? How do you partner with the city? Because like you said, you guys don't have a lot of funds. So if it's a city thing that we need to put away funds, we need to ask the county commissioners to put more funds into this. I think this is something we need to do because we need to set a tone because someone is gonna die. I know people who have gotten sick. But my issue is that a lot of these places are cash vendors. They're not paying taxes, right? They're taking their money back to wherever they're from, California, Mexico, Venezuela. So I think when it comes to a point where we just need to be enforcing. And if these people keep on coming back day after day, then the police just need to come on and help you guys and shut them down. Hey, grab your stuff, destroy it. Who cares at that point? So I guess back to my question, it was mostly a comment. What does enforcement look like from your end? And what do we got to do?
I appreciate that question. Thank you. There's a couple of things I want to respond to there. One is a great question about what our process looks like here in Benton-Franklin Health District. But there's another, bigger, what does that process look like at other health districts? And then what are we doing or what can we do to partner with our law enforcement to kind of push that forward? We don't have all the solutions. That's part of why we are here today and continuing the conversation. But right now, what our process looks like is we receive a complaint from the community. We're at the point where we can only do this complaint driven. We have 9 food inspectors, which is far more than a lot of health districts actually of our size. So we have a good sized food safety staff. But when we receive a complaint from the community, we're going to go out, we'll call non-emergency line, where no matter what city we're in, because we partner with law enforcement on these now. Usually non-emergency says, yep, we'll be right there, we'll meet you. There are some nights when they've got other things going on, understandably, and so we may have to wait or we may have to delay because we can't get law enforcement support that night. But typically we call non-emergency. Usually they're able to meet us within about 30 minutes at the site. We go through our whole routine, which is we offer education. We try to get the person interested in getting permitted. But at this point, we're seeing the same people over and over, and we're kind of past that point. And shutting them down would look like kind of like Mr. Cortinas described. We don't physically throw the food away, which is what Susan was saying. We don't have the authority for our staff to pick up the food and throw it away. So it is through a conversation with the vendor where we talk about, you're not licensed, we need you to shut down. We do ask for food discard. We do take temperatures. We do a full inspection of the booth. So we're documenting all of the risks that we are seeing at each of these. And then law enforcement is typically just there to support us for safety and just kind of be a little bit of a backup if they push back. But we've not faced, I think, significant pushback in the field when law enforcement is with us. Just kind of looking to you for your opinion there, since you're out there.
It depends. There are some vendors that are willing to cooperate with us. They understand that what they're doing isn't quite right. They will discard, close up. There are more vendors that are more resistant. They tend to push back. Officer support does help encourage to move on with the process. But it's definitely like a day-to-day basis situation. You go out there and you have to deal with what is out there. And it just takes patience, education, and the vendors who have cooperated with us, some have come to us, but mainly we have not had a lot of vendors come to us, try to look into getting approved, even with all the resources we have given.
And I'll add, and I know Jane has something to add as well. Right now, most of our authority in working with law enforcement comes through our municipal code. So, you alluded to what we do at the city level, right? Our three major cities around here already have municipal codes that prohibit food vending without a Benton-Franklin Health District. And so we are able to work with law enforcement through that. That's a violation of the municipal code that you're operating outside of health codes. It's a little bit of a loop around, but right now we're seeing good partnership with our law enforcement, but ultimately it's not sustainable for either of us, right? And sometimes there are obviously can be higher priorities on their list for the night. And so we want to just kind of get a handle on it. And I know Jay wants to talk a little bit about some of those efforts we have been and see with some cities.
And I actually wanted to say real quickly to the counselor, you can show me. You see about that.
And with that, I appreciate your question because it kind of speaks to the larger issue of how do we, as Benton-Franklin counties, start being part of the fix across the state, across the system. And that's something that I am very passionate about. This is one of those steps, is to raise community awareness of what's going on. The second part is, and it takes a coordinated effort, it's not easy, but when you're playing whack-a-mole, and you're a lone health district across 2 counties, we're gonna have to pull the system together. We're gonna have to pull the cities together, the counties together, the law enforcement together, so that it's not all falling on, let's say, the city of Pasco. Let's say you guys were to draft some code that allows us to have stronger enforcement. That's Pasco. They'll just go right across the river. So from our perspective, what we've been working on internally is trying to move towards a system process across the bi-county area. Because I want, at least in Washington State, Benton and Franklin counties, if we can, alongside our partner counties, to be leading the way on how we do this together. Because it's going to take all of us. And there's some frameworks we can pull from in terms of working with our partners and coming together across these cities. This is familiar territory for us. This is something I think that we've done really well in the pandemic. We work together, and I want to pull some pages out of that playbook about how we come together to take care of our bi-county area and our community. So Erin, I don't know if there's anything more you want to share.
No.
Hello, my name is Dave. I just had a question about, you guys talk about you got limited resources. This has got a law enforcement aspect to it. So I guess if it's a slightly losing battle trying to fight people who aren't really trying to play by the rules, me as a, citizen of Pasco or, whatever, I'm here and I'm learning stuff that I would have liked to know. I mean, I like tacos. I like to, see a place that pops up like, maybe that's good. There's a lot of people there standing there. But the things that you guys brought up in terms of, the food safety practices, the lack of stuff, like it seems to me educating the potential customers seems maybe more effective than going after trying to, people who aren't even trying to apply. So I think this is helpful, but how do you reach the people who aren't here, aren't watching on Zoom, aren't watching on Facebook? I guess that would be my question to you. What's your outreach going forward to the public at large beyond just this format?
Yes. So we actually, just for September was National Creativity Education Month. And we did a whole weekly update about 2 customers designed for Washingtonians. Something every single week about how to know if your food is from a permitted food facility, things to look for, things that you can do without a permit. We're not trying to say everything has to have a permit. A lot of what we're seeing on the street food vending, yes, that needs to have a permit, needs to be overseen. So we've done education that way. We're also working with the State Board of Health to see if there's things that we need to do in our code to kind of tighten it up a little bit, to make it something that the local health jurisdictions can actually go here. We want it to be transparent, right? Where it's like you're a vendor or maybe a customer, but people that are vendors, they have to know what the requirements are. We try to be very transparent and make sure it goes through a review process with all the community. So we'll be starting that probably next year. It does take us a little bit of time to look to change the code because, again, when you've been doing this job, we don't like to necessarily change it a lot. You talk to Mr. Cortinas, he's worked with food vendors for a lot of years. It is nice to have a consistent code, but we recognize we have a few gaps. So we're going to be working with our State Board of Health, and that will also have education. But part of it is by what they're doing here, by inviting their local media, having people like you help us spread the word, because a lot of people don't listen to the health department. They don't listen to the government, and so it's people like you saying, hey, there's a reason why this is happening. So we're doing whatever we can to get that message out because you're 100% correct. It really is going to be the public that can help us turn this. It's just like everything that we have with law enforcement, public health. It's that community approach that's going to help us solve this. And again, we are working on quite a few things, public outreach, communication in multiple languages. Also code changes, working with our partners. I also want to mention, it's not just local. We have people that are discharging wastewater, full of grease, fats onto parks, onto the freeway, onto, the rest stops that you see, on our highways. They'll discharge waste there. So this is an issue for ecology. It's an issue for Department of Transportation. There's quite a few of us, a Washington State Patrol we've been working with. It's also a potential criminal enterprise in some cases, and it has been dangerous. We've had inspectors threatened with bodily harm. We've had their vehicles, keyed, that's a good word for it, thank you, vandalized. But yeah, we've had quite a bit of aggression from the vendors also to the inspectors. And so it's a multi-layered issue, and we're doing what we can. But the biggest part, I think, is just getting that customer or consumer sentiment out there. So thank you for bringing that envelope.
I'd just like to piggyback off that. So like Susan said, at the local health department, we are also, we put out stuff for food safety. We try to put stuff out on social media. I know, you can submit a complaint, you can submit a report to us. If you have a question about a vendor on our website, you should be able to type in, under inspection, you should be able to type in, the establishment, and you can find if they're permitted, when their last inspection was. So we are trying to create as many ways as possible to have this information available for you. If you have a question, if you simply say, you know what, this taco stand, it could be permitted, I really don't know, I want to try it. My best friend said it's great. Give us a call. Tell us, hey, tacos, who knows, is open, they're on this corner, I just want to know if they're permitted. We'll gladly let you know if they're permitted, if they're not permitted. That is what we're here for. We are a resource. We're here to help, we're here to educate, we're here to guide. So if you need us, we will be there.
One more thing to add to that too, I want to bring back what Jenny said about our
outreach that we've been doing with our cities and with our municipal partners. And our hope soon is to get together kind of a task force, sort of a municipal task force that would include key city partners, county partners, law enforcement, public health. And this is a good point that you bring up, because we have talked about public information and communications needs to be a big part of that process. Not just the regulators coming in with their regulations and their enforcement, but it's the public sentiment here, right? Is spreading that word that these are not your mom and pop-up local vendors that are trying to make a living for their family. We recognize that the economy is really tough, and our aim is never to stop people from trying to make a living, but this is all signs point to this is not what that is. So we recognize that we have to really work on that kind of public sentiment there as well. So any ideas are welcome. Our communication folks are amazing.
I would also add that it takes everybody in this community. I think that's what's really special about us, is that we're not so big that we couldn't make a movement here. I think we're just the Goldilocks. We're just the right size to say that we've got enough of our community members that want to change it. And so it takes you, it takes everybody here, everybody online, all of our teams, all of our agencies. It takes the chambers. It takes all of us to change the status quo. So if we want something different, we're going to have to come together and change it. And I know that the state is looking for solutions, they're looking for answers. And I think that the Franklin counties can help provide some of those answers and those solutions. So, yeah, it takes all of us. I think my brain's spinning all over the place, but one of the other layers to this is I look at the amount of the many generations that we offer here, right? It isn't just social. It's the local news, it's the website, it's trying to find all the communication mediums in which we can spread the word. So, yeah. You can have it back.
Thank you. We also have a few questions online, but I just want to check, is there anyone in person that's got a burning question? Okay, so we're gonna go ahead and take some of our questions online.
Again, if you're wondering why I'm moving this cell phone around, it's because this is for our online individuals. So hopefully this is still working, but there's a question from Cynthia. She's talking a lot about enforcement, and the question is, if they're unlicensed, can law enforcement impound their equipment similar to operating? Oh, wow, my computer just shut down. Similar to operating a vehicle without a license. Can you elaborate a little bit more on that law enforcement aspect?
I can speak a little bit from the state side. So yes, we do have some of our law enforcement that has that authority within, as Erin mentioned, ordinances or local bylaws. It would be under code enforcement, traditionally it's what it is. It's usually because they have restrictions for itinerant vendors, people that move. And so that is generally under code. We do not have the enforcement to do any type of impound under public health. It would be through code enforcement.
And just that is that I don't believe that any of our local municipal codes have that authority, but that is something that some of our partners, I know the city of Sela recently passed an emergency municipal ordinance to authorize law enforcement to impound equipment for these types of vendors as in response to this situation. So I know there are some municipalities that are looking to those types of ordinances to help, because one of the layers here is that often the owners are not present. They're not local. They may be out of state. And so it is challenging to go out with law enforcement with the thought of the people working in the booths are not the ones who own these. So things like citations in the field are not necessarily getting at the heart of the issue. Whereas the ability to maybe impound equipment then cuts off their ability to do business. And so it's not something that we've looked at doing here yet, but I know that there are others that are going that route.
Erin, did you say Sela?
Sela.
Another question that we have online is from Sierra. Can Erin speak to how many inspections BFHD does annually for licensed food vendors?
I don't know that I have those numbers off the top of my head. We have, I can tell you that we have about 2,400 permitted establishments here in Benton-Franklin counties, and each of them receive anywhere from 1 to 3 inspections a year. So it is past 5 o'clock, so that math is not going to happen in my head right now. But we do quite a few, and that's one of the concerns that we have here is when our inspectors are out, when they go out to these establishments, they're operating late at night. So our inspectors are often out 8, 9, 10, 11 o'clock at night. And that means extra time, overtime, right? They're owed that and they work that extra time. And so that's time then during the day that they are not spending inspecting those 2,400 permitted facilities. So that's a concern, is that it detracts from our work. Not that this is not our work, but it detracts from our routine work. And it is impactful on our staff too, in terms of their stress levels and their capacity.
For those curious about the numbers, I know that the numbers are on our January newsletter that we put out in the beginning of the year, which is on our website. And just keep in mind that while we do the annual establishment, we also do a lot of temporary pop-ups. So our inspectors are inspecting all the time, along with all the other responsibilities they have to do, because it's not just inspecting, it's the reviews, it's looking at the foodborne illnesses, it's looking at the complaints, and our time is divided between all that. So when this problem arrived and grew, it definitely caused a lot more workload on our staff.
Thank you for that. And also we have another question from Steve online. Do food vendor carts or food trucks have anything on them that would show that they are permitted?
Very good question. And yes, so if you are a permitted food establishment in the state of Washington, one of our requirements in our food code is that you are required to post your permit somewhere where customers can see it. So we have a couple of things that you will typically see on a food truck, a cart. For us in Benton and Franklin counties, for trucks and carts, you should see the permit. So I don't know if we have a picture of one right now. Do we?
It's on the handout.
Okay.
Yeah, so if you all come down here at one point, on the frequently asked questions, so you'll see kind of a copy of that.
So you should see the permit posted. Now, sometimes vendors will forget to do that, or they don't do that. All of our mobile food trucks and carts in Benton and Franklin counties are also marked with a mobile food number. So there's a sticker that you should see on the outside of the food truck or the cart that has a number, and it has some language on it indicating that they're permitted. Past that, again, like Ariana shared a little bit earlier, we have all of our inspections and our licensed vendors available on our website. So you can do a quick web search or you can call our office and we can tell you very quickly whether they're permitted or not. Yes.
And our next question, it comes, let me bring it up. Sorry, I have many screens open. It comes from Brandy. Now, Erin, can you speak a little bit more about the disease investigation process? If someone believes that they got sick from one of these vendors, kind of that process of the initial complaint, how it comes through our system. Also, you know, from my perspective in communications, making sure that we have all of the information in order to really truly understand the initial complaint.
Yeah, there's a couple of different ways that these can come in. So we will either get a foodborne illness complaint. So if somebody got sick, they think they got sick from food, they will call, they'll do an intake with our food safety staff where they'll go through a really wide array of questions. So questions about your symptoms, where you ate, all the places you ate within the last several days. And it really is the point when we get that complaint, if the symptoms kind of match up with the right type of food and the right time frame for that type of illness, then we'll send our staff out to do an investigation at the restaurant. So that would entail us going through the food preparation processes, asking the person in charge about whether there's been ill employees, whether there's other customers that have reported ill. And then at the point, if we start to see a pattern, we have 2 calls or 3 calls or several calls that lead back to the same restaurant. That's when we typically know we might have an outbreak on our hands. And we're working with our food program as well as our communicable disease EPI program. And sometimes these will come in through our speedy EPI program when they are what we'd call a notifiable condition. So they're a lab diagnosed salmonella or E. coli or something where you've gone to the doctor, you've had a stool sample, they've diagnosed you with something, then that process may initiate through those epidemiologists of ours, and we would work together with the food and admin programs to kind of do that investigation piece. Yeah, just adding to that, the foodborne illnesses, we get quite a few of them each year and a handful of outbreaks every year, and they're also really impactful. I know we had a large one a couple of years ago that we actually did some time tracking on, and we calculated that it cost us almost $20,000 in staff time to investigate this single foodborne illness outbreak. So it can be really impactful, and I still have one outbreak that we investigated a couple years ago where from time to time I have a gentleman that will call me and update me on their health status after getting sick in that outbreak. And that one was norovirus, which we typically see as a little bit more mild. And still this gentleman calls and tells me 2 years later about the impacts that that's still having on his life. So I think about that from time to time and go, even our lower level outbreaks can be very impactful on people's lives. Yeah.
And a question actually for Dr. Krager online, you know, speaking of norovirus, something that has been unique in that is that it can live on the surface for several weeks. And just kind of talking a little bit about that virus that Erin was just mentioning, can you give us just your health perspective on why it's so important, the work that we do and working on norovirus as well?
Yeah, that's a great question. So norovirus is extremely contagious. It only takes just like a few viral particles to infect someone. So that any sort of contamination that happens on a surface or on food or people touching food, it can just spread very easily. One of the things that we emphasize a lot as well is that norovirus isn't killed by alcohol like hand sanitizers. You really have to wash your hands with soap and water. And that's why it's so critical that our food establishments have hand washing stations, not just for norovirus, but obviously for everything else as well. But just a hand sanitizer, spraying that on your hands and rubbing it in isn't necessarily going to kill norovirus. So that's one of those key ones that we really, emphasize the importance of hand washing. And again, not always compared to things like E. coli or salmonella, not necessarily causing the most severe illness. But if you've had norovirus, you know how terrible it can be, even if it's just a short amount of time, and how quickly it can spread throughout a household or a classroom. So yeah, hand washing, and I just want to emphasize how contagious it is.
Thank you for that, Dr. Krager. Our next question online is from Ryan. It's directed at Susan. Susan indicated that the Board of Health resolution may facilitate the authorization of food destruction. Has this proposal been presented to the Board of Health for BFHD, and what is their level of support on this issue and passing such a resolution?
So I can speak to it from the state side. We are facilitating to the board, our state board of health next year. That would be for changes to the state rule. Again, that'll go through a comments period. That is not something that we would just make changes to. I can't necessarily speak though to what happens with the local board of health. So again, the state oversees the food rule, WAC 246, 215, the administrative code. The local health jurisdictions operate under the auspices of their local board of health. And that's, I think Erin will speak to that a little bit.
In terms of our local board of health, we have engaged them a little bit on the issue. We've brought kind of what we're bringing here to you today. We brought them the background, talked about the issue and some of the challenges going forward. We would, in this case, to pass some sort of local ordinance that would not supersede, but it would tighten the state rule, is not really something that we're looking at right now. We, especially seeing that there is some movement happening on this at the state level, will probably kind of watch and wait as that process plays out. And I know Janae was gonna tag a little bit on about our engagement with our Board of Health as well.
Yeah, I would just offer that the Board of Health is paying close attention to this in terms of what is our needs and what are we recommending. So I don't know that it's something that the Board of Health has refused to do at this point, but they're leaning on us and the experts and our partnerships with the state to understand how we move forward. So I would definitely say that the Board of Health supports us trying to raise awareness and trying to coordinate efforts here and work with other local municipalities. But at this point, they haven't weighed officially on that topic.
And just another quick canvassing in the audience, any additional questions? Any questions, Angelise, from your team over there? And anyone else in the audience? Okay, I'm checking one more time online. Okay, here's an anonymous question that has just come through. Have you been in contact with other nearby health districts about getting together to find solutions across the region or across the board?
Yes. Oh, I know. Ooh, thank you. Probably for about the last year, I would say local health districts have been talking about this, and with the state included. So yes, this issue has been raised for quite a while, and I talked with my counterparts with it about it quite a bit. In fact, last week we were many local health jurisdictions were at a conference together in Vancouver for most of the week last week, and this was a large part of our agenda that we talked about. So we do know that others are aware. I alluded a little bit earlier to the relationship that we've had with our local law enforcement. We've had quite a positive relationship when it comes to this issue. We've felt a lot of support. And I know that that's not the case everywhere. And so I know there are others that are working just to try to get kind of their local law enforcement on board with them. And we're working with, others at the state and now engaging, trying to the governor's office and others to look at how we can make sure that we're kind of applying an equal approach across the state to this issue. Do you want to talk a little bit?
I would just like to add that we're similarly working with other states. So we're working with Nevada, Oregon, Idaho, California also, because this is a systemic issue from the borders to the north border. It's throughout Western US, and it's in other states as well, but we're primarily working with states that are up and down the I-5 corridor specifically.
Thank you. Like tag. We also have another question, which I feel like may have already been addressed, but I feel it's important to ask anyways, from Rick online. If this looks like a widespread coordinated operation, is there a statewide effort to join forces to move this out of the state or into compliance throughout?
Definitely. We are working with federal partners as well. We do believe this is pretty close to a criminal enterprise. And so we're looking at it from our federal law enforcement partners also. So not just state patrol, not just local law enforcement, but also our federal law enforcement partners. We're also even looking at USDA and other food safety at the federal level also, because this is quite an operation. Some of the ones that we've seen are quite large.
Thank you. Another really good question online. As there's a few more that have popped up. This is great. We love it. Okay, so someone had asked, it's from an anonymous source. It was mentioned earlier that this has been an ongoing issue 2 years prior. Why until now was this town hall brought up to educate the public?
Oh, I think I'll answer that. Yeah, I think I was alluding to 2 years. I was talking about our 2 years worth of our complaint data for our unlicensed vendors. And I started in food safety at Benton-Franklin Health District in 2006, and unlicensed vendors have always been a part of our world. But it really hasn't been until about the last 8 months or so that this issue has really sank in. And it took a little while, to be honest, for us to connect the dots with Yakima and Walla Walla and King County and all the others and realize, oh, this is coordinated. This is, we for a while, we kind of thought, oh, this is just something that we're battling here. And man, this is getting bad. And then it took a little while of us talking with our counterparts across county lines to realize this was more of an organized effort. So we have actually done quite a few, like Susan said, we've also done some social media campaigns. We've done some media, we've done blogs, we've done web updates, lots and lots of coordinated media campaigns, but we're bringing this here too, because we're not quite seeing the traction that we would like with those. And so we need to talk with our municipal partners, our public, our community to figure out different ways to get the word out, because we have been trying to do that. And just trying to continue that conversation here tonight.
I also wanted to add, Erin, just to bounce off of you, I think when we look at how did we get here in the length of time, when you look at this presenting initially like another scenario of unpermitted, that education process isn't a run and jump to enforcement. And so it takes time for us to go out there, do education, and when you look at these are popping up, they're popping up in hours that are between 9 and midnight and 2 o'clock in the morning. And so for our inspectors to be out there that late at night and trying to piece together the puzzle of what's happening, it takes time for the system to understand what's happening, as well as understand that they're not moving through the education process. So I think for us, it was important, probably in the last month or so, is when we started putting together a campaign to say, we need to raise the level of awareness for the community so that we can get you guys engaged and help advocate for what our values are here, what our priorities are, which I think is fair business operations, it's public safety, it's doing the right thing by our community. And so I think the timing is great for this conversation.
With the same, because I'll probably give it back to Janine. There's another question online. Actually, this kind of probably goes into a little bit of what we're talking about, you know, especially when you approach, you know, a food stand in particular, and, you know, what's that first initiation process? So one of the questions is, when you go out to the taco stands, what does that look like? Is food being thrown away to make sure it's not served? If so, how are you getting them to throw it away? If you say you don't have the authority to throw it away, what does that look like? So kind of when you, the conversation too about that education portion, as well as, you know, how does this process work?
I'll touch on that a little bit, and then I'm sure Ariana will have something to add because she's been out to quite a few more of these than I have. But when no matter what type of vendor it is, whether you're selling fruit, whether we come across an unlicensed vendor often at temporary events, maybe people who are well-meaning and don't know they need a permit. Whether it's that situation or this situation, we're gonna go out and always touch base with them first with inquiring whether they have a permit. Usually we know because we have a list, right? We know where all of our permitted locations are. If not, then we're gonna do a little bit of an inspection of the booth. Now, if you are operating at an approved event, say you're operating with a fair, a festival, the flea market out in Pasco, and we come across you and you're not licensed, but your booth is set up appropriately. You have a hand washing station, you have refrigeration, you have your food hot. We actually don't ask you to shut down. We ask you to come in on Monday and pay for a permit, and thank you. We'll do your inspection and you can keep going the first time. After that, you know, then you need to kind of come into compliance. But the first time we come across people, if they're set up and operating appropriately and operating within the bounds of the food code, which would allow you to operate at a temporary event, then we do actually allow you to continue operation. After that, again, when we've seen you 2, 3, 4, 10 times out in the field, we know you're not licensed and we know you're not interested in getting licensed. We still do that inspection. So we're still doing an inspection so that we can make sure to document all of the food safety risks that we're seeing. And then we would work with the person in charge to discard the food. Again, it's been mentioned a few times tonight. When we say we don't have the authority, we mean we don't have the authority for our staff to physically pick up the food and throw it away. So we do not, but we do have the authority to ask them to throw the food away or to put what's called a hold order on food. In most cases, there are some cases where we've come across these vendors where there is no garbage can on site. And we're not obviously going to ask them to throw the food on the ground. So in those cases, we would wait and watch for them to pack it up and wait until they leave. But if there is a dumpster or a garbage can there on site, then we are directing them to throw the food away. And typically, if we do have law enforcement and some additional support there, then we're able to get that compliance. And I'm going to ask Ariana if she has anything else to add in terms of the inspection and what we're doing out there.
No, you pretty much covered it. Like she said, we go out there. Not everyone knows, you know, that you have to get a permit or what you need a permit for. So sometimes we do come across vendors. They do have the right setup. If it looks appropriate, it's at an approved event. Okay, come and pay on Monday. And like she said, we don't touch the food. We communicate with the vendor. We tell them, you know, we ask questions. We're not just gonna go in there and be like, hey, throw away the food. We wanna know where the food came from. How did you transport? Where did this food come from? And, you know, when you start asking these questions and every answer is, I don't know, then that's a huge safety concern. And so that's where you start pushing like, okay, well, we don't know where this food came from. We know the temperatures aren't appropriate. You don't have a hand wash. Okay, this food needs to go. And that could be the difficult part. We're getting cooperation from the vendor to get them to discard the food. But it really is a lot of communication, patience, and education.
We have another question online. It comes from Greece. Can restaurants get a yearly permit to be able to operate outside in front of their businesses to operate?
That I would say is not a straightforward question. That's it's a very good question, but it's a little bit more complicated than just across the board answer. So it would probably depend on your what permit you have, what you're allowed to do under your permit, and what both the inside and the outside of your business look like. If you're gonna operate outdoors under a pop-up, there are kind of a few cases where we do allow that. If it's an event, so say, you know, sometimes a business will have a grand opening or they'll have some sort of special event that's associated with their restaurant, then there may, you may be able to do that under your permit or with a temporary add-on to your permit. And there are some cases where we wouldn't allow that. There are some cases if you're setting up in your parking lot and you don't have hand washing available and you want to bring some higher risk foods or you want to do food preparation out there, it may not be allowed. My advice is if you're asking that question, if it's coming from somebody who is a restaurant owner and is truly curious about that, would be to connect with your inspector, explain what you want to do, your business, maybe even come and sit down with them and go over your business plan, and then they can help guide you through that process.
I have a question that's not online. It's actually just a question that I see quite frequently on our social media and just from the time I've spent at the health district. We have a lot of very giving people in the community, and for food donations, or people that are giving to those in the community, what are the rules and regulations of things like that? I know sometimes things get blurred, and sometimes people are not quite sure if this is appropriate if you don't have a license, but sometimes the donations, there's different rules. Y'all already asked first. I just ask questions.
I'll tackle this one, but I may tap on Susan a little bit because I've been out of the food program for too long. There are limited situations, yes, where you can donate specific types of foods from your house directly to food donation centers like food banks. So it's always okay to donate things like canned goods that are in good condition, things that are what we'd consider non-perishable, right? Not things that require too much refrigeration. In the case of a restaurant, is that kind of where you're going at? If you're a restaurant or a business, then you get a little bit more allowance to donate different types of things, extra food you might have, as long as it's not necessarily been served out to the public or has been properly temperature controlled and properly held before that point in time. And I'm going to ask if Susan has anything else to add on there, because I don't remember my dicto code too well.
So there are we got the majority of them, but people can also donate if they use what's called a donor kitchen. And so if you are going to maybe go to a community center, a church, you can make food and take it directly to a donated food distributing organization such as a food bank. And that's what a lot of people want to do. So we have some restrictions to not using your private home for selling food items. And Erin talked about a little bit about baked goods, things like that. You can donate. We want you to have a relationship too with who you're going to take the food to in order to donate it, because they'll tell you what they can accept and what they need. And that's really, I think, the way to go. What can I help you with?
What can I provide? And so, work with your local food bank, your local mission or resource center that you can go, hey, what kind of foods would you like? And then there are quite a few options where you could make it potentially in a community kitchen and then take things that you do want to take, some of your food items they could accept. So again, there are some restrictions for your private home, but you do have some options that you could use a non-private home and actually do your food. Just get your partnership set up in advance. And again, they've mentioned it multiple times. Your health department can help you identify some of your options. But thanks for donating. We do appreciate it, by the way. We want to encourage as much as we can.
Absolutely. And also too, this I think it's the Thanksgiving spirit that's coming up. One of the questions online, but I need a permit if I wanted to make a Thanksgiving meal at home and give it to the homeless for Thanksgiving. Those are kind of the questions too that, I mean, we get through social media. So is there any way to, even though you might have already answered it, but just
a good question. I think Susan answered that a little bit in her talking about you would have to use some sort of a community kitchen or improved kitchen for that. Yeah. If it's our, what we're thinking of as our traditional meat and but again, there are elements of the meal that you could certainly donate that you can make from home. and reach out to us at the health district and we can walk you through in a little bit more detail.
A lot of good people in our community, which is awesome to see. I am just gonna request one more opportunity online. May mean that we end early. Shocking, which is good. Anyone else in the audience that has a question regarding food safety, anything along those lines? Well, I look also on Zoom and we've been live on Facebook as well. Thank you, Noelle, for setting that up. She's our communications coordinator. We have a lot of people that we're very thankful for. We've got Eric, Lauren, and Angelise. We have some of our representatives in the audience as well, Heather and Julie. And again, thank you so much, panelists. Y'all have been phenomenal. Dr. Krager, I'd love to just see too, if there's anything super specific that you want to add, you know, as the health officer perspective. There's, or even happy Thanksgiving to everyone as well. You know, this is something that you have a lot of authority in different aspects. Not everyone quite understands your role. So in this realm, could you maybe explain a little bit about that, your role for food safety and what you look forward in the future?
That's a big question, Amanda. I'll do my best. Yeah, I mean, so ultimately when we do any sort of enforcement, you know, it kind of comes through the health officer. You know, I work very closely with our team, with Erin, any sort of complicated situations that arise. I think I would just point out that this whole situation is complicated, right? It's difficult. There's lots of different factors. And, you know, I really appreciate how thoughtful kind of our team has approached it. And I think it will take, you know, just not just our team, but a lot of our partners to kind of come up with a good solution. So I'm really, you know, I am thankful that we're working towards that. Ultimately, I think we all want the same thing, which is for our community to be healthy, for businesses to be operating safely, and for people to be eating good food. So I'm, again, hopeful that we can continue working towards that goal. And yeah, I do want to wish you all a happy Thanksgiving. I hope even at home your food safety practices are in place as well.
And again, just thank you so much for that, Dr. Krager. Thank you for being with us and for all of our panelists. We want to provide some information for follow-up communication. So Eric, if you don't mind putting up that last slide up there, it's got our phone number as well as our email. If you have any additional questions, or as some of our panelists have said, you know, if you're looking for a vendor and wondering if they have a permit, or if you have any questions at all, you can reach out to us. We've got a phone number up here, 509-460-4205. Or you can also contact us, Food Safety, at bfhd.wa.gov. We have 2 handouts that are both in English and Spanish. Please take a few as well. If there's people in the community that you'd like to share some of those resources with. We have frequently asked questions for our vendors, as well as different types of permits and how to get the permit, that process. Again, our team is really here to help you, and our promise, we don't bite. That's just dogs. I'm thinking of rabies and public health and what we do here. Not ending on a very cool joke, so I'm going to pass it over to Janae Parent, our district administrator, to close this out.
Thank everybody here in person tonight for coming, and to all of those that are online. I see we hit 51. That's great. I love it. For those that don't know, I love big town hall. So not only have we done this in the past, we did it today, and we will keep doing it when there's topics that we want to connect in with you about. One of the things that comes to my mind right now, my team knows, is really good together. They have the same beliefs for our community. We do it together. We fix these issues together. And in doing so, one of the things I'm really proud of is that this isn't the federal government that's here at your doorstep. This isn't necessarily state government at your doorstep. This is local government staff that live and work here in Benton-Franklin counties that are familiar with the issues, familiar with the priorities that are coming to you. So please keep reaching out to us, whether that's on social or calling us or stopping by the office. We appreciate you guys. Thank you.